Everybody. I welcome you all to the second episode of the Anxiety Disorders webinar series, which is hosted by the Anxiety Disorders Clinic, Unit 5, Department of Psychiatry, NIMHANS, Bangalore. We have a very interesting theme today, which is anxiety disorders in private practice of psychiatrists beyond medications. I would now like to request Professor Dr. Suresh Badamat sir, who's professor and head of the NIMHANS Digital Academy, to introduce our guest for today.
Good afternoon, everyone. I don't think anybody need to know about Dr. Srinivasan. Dr. Srinivasan himself is an institute doing group therapy since many years. I came to know about his group therapy from a patient who visited NIMHANS, and slowly I gathered information about Dr. Srinivasan, and I came to know he is a person who is a silent but does a lot of work. And if you ask me, he is one of the person who requires no introduction in Coimbatore and the nearing districts, and as far my knowledge goes, around Tamil Nadu. But anyhow, I would like to introduce Dr. Srinivasan, and it is my privilege to talk about him and introduce to the gathering. Dr. Srinivasan Dorairaj has done his DPM and MD. He is a consultant psychiatrist in Kovai Medical Center and Hospital, medical director in Kasturba Gandhi De-Addiction Research and Rehabilitation Center from Coimbatore. He completed his both MBBS, MD, psychiatry from Madras Medical College, one of the prestigious institute, and DPM from Institute of Mental Health, Chennai. With the 40 years of clinical experience, he has been doing groundbreaking group therapy. As far my knowledge goes, I'm being in psychiatry since almost 22 years. I know only few people who are doing group therapy. Dr. Srinivasan has changed the way the group therapy is done. Invariably in Western country, we do only 8 to 12 people as a group therapy. But here our Dr. Srinivasan is going to introduce about that. He has broken that barrier. He has taken almost 100 to 125 patients and the family members in group therapy. And his 12-session monthly group is the model which he has developed, which has become very famous. And he has conducted more than 1,500 group therapy. During COVID, he switched over to online group therapy. And he has found a global academy for total empowerment, GATE, which focuses on life skills and emotional intelligence. He talks about group therapy, not just for therapy and coming out of this anxiety disorder. He says he goes one step ahead and wants to bring in wellness, which he will be talking. He has contributed numerous conferences as a invited guest lecturer, received several awards, including the Best Award for Lions Club for Karur and the Indian Medical Association Coimbatore Award. And in this 1,500 group therapy, only once he has missed doing group therapy. That was during the Vishaka variation in 2024, when he was called, the date got clashed. That is the only day he has stopped group therapy. Otherwise, he has been doing group therapy, that is in-person group therapy. And he is founding father of the positive psychotherapy. Without much delaying, I have told you he is a big person, but he doesn't speak about himself. His work speaks about him. So we welcome you, sir, and I welcome all the delegates who are available here. And he is an encyclopedia of group therapy and that group psychotherapy. And I also would love to learn from him. And over to the organizers, Dr. Nikita.
Thank you, sir, for that wonderful introduction. I'm happy to announce that we almost have 130 participants in today's webinar, which is very exciting for us. We thank you all for being a part of this. So without further delay, Dr. Srinivasan, sir, over to you for your presentation.
Sir, your group therapy can be started now.
Yes. We are all in group therapy, sir. 1 minute. There is some...
We are able to see your slides, sir.
1 minute. I think it's that.
Now make it slide view, sir. Can you make the slide view? Yeah, right, sir.
Thank you very much, Suresh, for that wonderful, glorious introduction. I reformed myself with your introduction. Thank you very much for that. In fact, I have been doing this group therapy from 1995. And the seeds for this were sown when I was doing my MD, when I was working in the neurosis clinic. And I was wondering, what are we doing beyond prescribing benzodiazepines and antidepressant? Should we not be doing more? That's when it started. But for it to take effort, it took probably another 10 years. 1992, when I came to Kovai Medical Center, the psychiatry department was not established. So the initial cases were referred from other departments where they have been holding on for a long time and they were not able to manage. That kind of cases came to me. So almost all the cases which came to me initially were that of anxiety, depression, somatoform somatization, rather than frank psychotic cases which came much later. That's how I developed my interest and found that my training in institute was not adequate to handle it, so I have to learn on the go to deal with it. That's how I started. And in 1995, I thought the numbers have increased, so it's difficult to engage them individually. So I have to start the group therapy. As you rightly pointed out, initially I was doing small groups, 8 to 12, homogeneous, diagnostically homogeneous, educationally, 6, and all that. So I was doing a separate group therapy for sexual dysfunction, separate one for anxiety disorders, then for depression, then for alcohol groups, and it will be men separately and women separately because of certain issues and all that. Then over a period of time, it was really taxing, and there are certain things which happened over a period of time which changed the way I conducted group therapy. As you rightly said, the largest one was with about 250 patients and relatives. That's the numbers we have reached. So we have broken all barriers and it is working. And you said probably the confidentiality and other things that has happened in the West, some of the Indian culture probably admits discussing even personal matters with strangers comfortably. So that probably has helped me to do these things. So let's move into the outline will be why, what, and how do we conduct group therapy, the evolution at KMCH, and applying what is learned in the group to everyday life. So the types of groups is psychoeducational group, counseling or interpersonal problem-solving group, psychotherapy group, support group, and self-help group. Though these are mentioned differently, the group therapy I conduct almost serves all the purposes. I'll explain later how do you do it. And what are the advantages of doing it in group? Because they provide a social atmosphere that's similar to the real world. Here they're much more comfortable learning things, expressing things, and sharing their even personal problems. In fact, one patient mentioned that if I talk to relatives, probably they don't listen beyond a minute or two, and if I repeat for the second time, they're really irritated. Here, people are eager to listen and also offer support, and they also share. So I feel much more comfortable talking about myself here rather than to my own relatives. So each individual is a therapist for the other person. Like that, it serves as a group support. So groups provide more opportunity for social learning, can interpersonal skills, and members can practice new interpersonal skills on each other. And again, it's cost effective. In fact, to talk about the cost, we don't charge anything separately for the group therapy. So I will say it's more time effective, and they provide commonality. In fact, when patients come to me individually, they ask me, even after 40 years of experience, even 2-3 days ago, one patient asked me, "Doctor, have you seen a patient like me? Am I unique? Is my problems are common, or it is something unique only to me?" That kind of things happen to almost every patient with any years of experience. Whereas when they come to the group, they identify and understand that his problems are not unique, and when compared to some other people's problem, his problems are not even problems, they are very minor. That itself proves to be therapeutic. And they also become aware of how others view them and what impact their behavior has on others. Group dynamics can replicate family of origin dynamics, and members make public statement regarding change that's more likely to follow through what is stated. Like we ask smokers to tell to their friends when you quit, so that will keep the as a motivation for them to quit. Like that, when they announce these are the changes I have experienced following the group therapy principles, that helps them to retain without slipping back. And they receive feedback, support, and challenge. And groups offers diversity of perspective. That's another advantage. Is more effective than individual one-to-one therapy. In fact, somebody says, Doctor, money is not a problem, time is not a problem. Can you offer whatever you're offering in the group therapy to me on a one-to-one basis, 36 hours? Can you give it? I can give it, but I can assure you that it will not be as effective as they are participating in a group. That because rather than one therapist, there are multiple views and multiple things, and other people sharing their experience of how the change has happened definitely makes a larger impact in the therapy process. That's one of the important things I have learned in conducting group therapy over a period of time. And another important thing is whatever you do to eliminate stigma about mental illness is not going to happen. Whereas when you do this group therapy, especially for common mental disorders, this has eliminated the stigma. Earlier, people used to find it difficult to sit down in front of my room. Now, some of my colleagues are surprised that hundreds of people are crowding in front of my room at the end of the group therapy. Nobody is afraid. So that kind of change, eliminating stigma. In fact, one of the patients asked me, like some of my relatives and friends are asking, what are you doing going there month after month? Don't tell them group therapy. You tell them that you are attending a personality development session. So that way we can do a lot of things in eliminating stigma regarding mental illness when we focus on common mental disorders. In fact, Dr. Manjunath was asking me a question, what made you interested in like anxiety disorders? In fact, in the initial stages, some of my friends were even saying, like, your precious resources are being wasted on this anxiety disorders. You should be focusing on severe mental illnesses. I said, this needs much more skills and this needs much more attention than the severe mental disorders, because there it's drugs, and beyond drugs, there is nothing much where we need to work with the individual. So this is what said by one of the patients in the therapy. I was treated with respect, listened to, not judged. I was able to say in public what my symptoms were and how I felt. Met other people who had what I had and which received the feeling of isolation. I learned from other members of the group what worked for them and copied the skills that worked for me. I got compliments when I did well. I had a chance to give and get feedback. So they feel much more comfortable in a group, unlike people said, like issues of confidentiality, whether people will share their inner experiences, will they be mocked, that those kind of things will has never happened. In fact, a lot of people have asked about this issue of confidentiality and things like that. So far, luckily, like 1995 to 2025, 30 years of group therapy, almost more than 1,500 sessions. So far, no problem has happened regarding these issues. So group composition, as I said, started with very, very homogeneous group. Now it's a very, very diverse group with patients and their relatives. Then the group size, I started with 12, experimented, and slowly I moved on to 100 to 200 plus. Frequency and duration of meetings, initially I tried with once a week groups, once in 2 weeks groups, and finally settled to once a month, because that helps in many ways, and also that gives them enough time for them to practice the skills that they learn in each group therapy sessions. And it's an open versus closed group. It's almost a closed group. They continue to come over a period of time. The length of the group is 1 year. That's 30 groups. They almost like handing over the baton on the next first session. So it's 13 sessions. Each session is about 3 hours. And the place, that's one of the important things. Some of the people have come and checked with me, and they started. And then they say that, one, the infrastructure. Here, I had a very good support right from the beginning from our administration in giving me small classrooms when the groups were small, and even the conference hall to conduct the group therapy sessions when the group size became bigger. That's another thing that may be needed for individuals in private practice planning to start. And a few people started with small groups. One of the problem with small groups is dropout. When you start with 12 groups, for the second session, there are only 8 or 6 people come, third session, only 3 people come, then you lose interest. Whereas here, when the group is larger, then even without the dropout, you don't find much of a change. And about the contribution from the people, again, in the larger group, it's much better. So informed consent, provide members with adequate information that what will happen, and we inform them well in advance, and it's up to them to join the group. Nobody is forced to join the group. In fact, many people are wanting to join the group. In fact, some people hearing from the other patients request me, doctor, when will you be putting me into the group? When is the next group? That's the kind of like eagerness from the patient is there. So we don't force anybody to join in the group. But joining the group, it requires discipline, coming on a particular day, spending almost the whole day. That is one of the disadvantages. But people are willing to do that. They have the benefit of 3 hours of input. That's a great thing. So some information go to prospective members, the nature of the group, goals of the group, general structure of the session, what is expected of them if they join, and what they can expect from you as a leader. So as I said, the prevalence of medically unexplained physical symptoms in the medical OPD was high, and the average cost of healthcare for a patient with untreated somatoform disorder was $30,000. They take at least 3 to 5 years before coming to the psychiatrist. They even end up going through unnecessary surgeries, sometimes endless investigations. So all these people needed intervention, and that's where it started. So what I do initially, I evaluate the physical symptoms, elicitation of associated events, establishing the connection between the things. Like one of the patients who came to me after almost 4 years of onset of this non-anginal chest pain, he has undergone 2 angiograms and all that. When I went into the history, after only 2-3 visits, he could go back to the original time where it started, where one patient died of a heart attack. He was okay. Within a week, second patient died of a heart attack. Second individual in the same street died. He developed chest pain occasionally. When within another week, that is in the span of 15 days, 3 people died of heart attack. That's when he started developing chest pain. Repeatedly in the night, he goes to the hospital. He had like more than 100 ECGs taken and all that. So when you are able to establish the connection, this is when it started. This is where how the fear started. So that's very, very important. And also what are his worries and reassurance, all these we give in the initial stages. Then symptom reproduction. In fact, when I conducted an anxiety disorder workshop in the Tamil Nadu Society, or even when I was talking to Dr. Manjunath, he was asking what is that. When somebody talks about palpitation, I tell them go to the ground floor, then go up to the 6th floor 3 times, walk and come back. Then they come back and sit down in front of my room. After 5 minutes, I call them. So your heart rate went up, what happened? So with physical exertion, it can happen. With anxiety, it can happen. So nothing will happen. So that itself gives more than 50% relief. So symptom reproduction is a very, very important thing. Some people come with dizziness. I ask them to hyperventilate. And is this what you are getting? Then pins and needles. And he was asking some of the things which are specific in our culture. Like nobody talks about burning sensation, whole body burning sensation as a symptom of anxiety, which is quite common in our people. These people visit neurologists, and even when the patient says whole body burning sensation, they end up getting worked up for peripheral neuropathy and things like that. Then they go up to even thalamic syndrome, all that. After excluding everything with extensive cost, they come back. And probably 1 or 2 sessions, they get the relief of that burning sensation. Then another important thing I do is ask the patient to write. That saves a lot of trouble for the therapist and the patient. After 1 or 2 sessions, when he develops the confidence in you, I tell them, write the events coherently, right from the beginning. The point at which you are completely all right and since when it started. That is how we are able to like even when they complete this writing and come, they are 50% relieved because they say that, doctor, I have understood the connection between my symptoms and how it started and things like that, even before he explained. Then identifying the core belief system, and sometimes we use rating scales. And again, Manjunath was asking in an informal chat, like how difficult or easy to classify. I tried using ADIS for anxiety disorder interview schedule 4, but our people don't fit into a specific anxiety disorder. It's a spectrum, and also have a mixture of depression. Probably all these patients we can put into a broad category of mixed anxiety and depressive disorder rather than trying to go into the independent ones. So this is the group process, the social, biopsychosocial, that's what we talk about. So we also use cognitive restructuring, altering the thoughts, distorted beliefs, self-talk, and the personal scripts, reframing. In fact, we use some of the technique, content reframing and context reframing, and use some proverbs like the Chinese one. I was cursing God for having made me so poor that I cannot buy a pair of shoes until I saw a man without legs. Now what happened? You are thanking at least you have legs. So these are all the kind of small little things, but when they are prepared, and at that time when you see this have a greater impact. And also they develop a lot of things about interpersonal skills and control of heightened arousal. That's what we do. 12 sessions once a month, 3 hours, group process, which teaches I am not alone. My problems are not uncommon, and also process sharing and eliminating stigma and evolution of the process. Like, as I said, initially I was doing it for the males and females separately. But after some time, what happened was, because the females have to be accompanied by a male member, they don't understand the importance of the group sessions. First session, I would have started with 20 people. Second session, there will be 15. Third session, 5 or 10. So after some time, I almost stopped doing sessions for the females. Only the male patients I was doing the session. Then in one of the sessions, a wife who had come with a male patient asked, can I come into the session? I said, there will be about 30, 40 males, you will be the only female, is it okay? She said, it's okay. Finally, she was the one who was most benefited from the session. Then I said, okay, we can mix people. Then I decided, okay, we can mix the relative also. This is how it evolved over a period of time as a mixed group with relatives, large groups. Each one had its own impact, and it came as a solution to a problem. Whenever a new problem comes, I find a solution, and that solution leads to growth. And that's what I give it to my patients also as the positive one. So this is the concept I use. First is the self-acceptance, autonomy, personal growth, environmental mastery, positive relationship with others, and purpose of life. So this is what I mentioned about positive psychotherapy, and also the aim in treating schizophrenia is taking them to the pre-morbid functioning level, whereas the aim of treating anxiety and related disorders is not returning to the pre-morbid functioning level, but one step above that. Because again, there was a question like from my talk saying that you have said anxiety disorders are equally disabling like the major mental illness, severe mental illness. I said it's more disabling because even if you take Freud, psychosis is normal psychosexual development and regression to the previous functioning level, whereas neurosis is fixation at the previous level itself. They don't even progress beyond that. There is no normal psychosexual development. Like that, anxiety, though they may be presenting with the symptoms of anxiety disorder at 20, 15 or whatever it is, but if you take the futures, the background music of the anxiety disorders was there from age 5. So they have functioned at a much lower level than potential. They don't ask questions, they don't raise doubts, they don't come out and express their talents. They keep looking at others, they have a low self-esteem. In fact, low self-esteem is at the cause and effect of almost all this anxiety and depressive disorder. So one of the sessions we specifically focus on improving the low self-esteem. So this is again the same. So what are the Yeah, it's almost 2:55. Dr. Manjunath, tell me when to stop. Probably stop, and then we can go for question answer session.
Another couple of minutes. You
Yeah,
can.
sure.
Yeah. Thank you, sir.
So we explained the mind-body connection, reducing autonomic arousal. We used relaxation, breath observation. In fact, it's a very, very simplified Vipassana. I just tell them, close your eyes, observe your breath. It may be for a minute, two, or something, but make it a point that you do it for 30 minutes as a whole, not necessarily 30 minutes at a stretch. We also use imagery and visualization because they already do it in a negative way. We go it and do it, and then the role of conscious mind and subconscious mind. We discuss a few case studies, how people came and how it was used. And I also use hypnosis and NLP for these things and other things, of course. We don't do a formal CBT or mindfulness practices, but here and there we take a few things and give it to them and they do it. And one of the important things I give is the gratitude exercise from Martin Seligman and other practices from strength-based coaching. The thing is like 3 things I'm grateful for. When I ask them to write, then they start focusing on what they have, and because most people focus on what they don't have. And that is one of the cause and the effect of depression. In fact, one of the studies talks about in depression, the problem is they don't remember the positive things that have happened. There is a selective memory disturbance, the positive past. So that is one thing we took it. Then acceptance, because inability to accept the past and move on is one of the important problems where we bring in. And I also teach them the power of appreciation. I tell them, when you appreciate others, you grow. So you make it a point to appreciate at least one person genuinely in 30 days flat. You will change a level which you won't recognize. And we also make them give it in writing. So then homeworks also we do that. Then self-disclosure, all that. So I'll just read some of the feedbacks. One of the exercises I give is planning the day for 5 minutes while you are in the bed and revising the day for 5 minutes. And after revising, you do the gratitude exercise. That's how I do it. And observing the breath for 30 minutes. Then I also teach a technique called 1 hour, 1 minute. At the end of every hour, you recollect what has happened in the last 1 hour, because it becomes a very great self-awareness tool and also gives the self-correction. Because when others give a feedback, others ask you to change, you never do that. But when you are willing to do it on your own and when you realize your own mistakes, then the change happens naturally. So this happens with 1 hour, 1 minute. Originally started as a memory tool, but it came loaded with more than 100 different functions. Then, of course, stress diary. That's the important thing I ask people to write. Identify the stress, bodily changes, mentally changes, and the time taken to recover, and why that particular event was stressful. And they also identify the recurring stressors and the occasional stressors and how to handle it. Then the 5 minutes before sleeping, 3 things I am grateful for that I talked about. Overall, during this past 3 months, I have accomplished several feats like scoring 9 GPA in my exams and clearing the GRE examination and working with great cooperation with my team to finish my final year project. In fact, he had come for an irritable bowel syndrome, and the patient was referred to me by the gastroenterologist because of the anxiety disorder causing all these problems. And he attended only 1 session, the first session, and this was the feedback from him. So this is the appreciation slip. I asked them to do it, write it. These are some of the groups, various places. And this is what I teach, like pessimism, self-image, low self-esteem, emotions. In fact, negative emotions, we talk a lot. Emotional regulation, we talk a lot. But we don't talk about how to develop happiness, from small little things, and role of choices in life. Like at every point of time, you are making choices, but you are not aware of it. And you take easy choices, but easy choices won't get you anywhere. And taking charge of your emotions. So I take lessons from Stephen Covey. Instead of reacting, responding, there is a fuse between the stimulus and the response, that kind of things also we teach the people. Then once you teach them anger is bad, then we have to teach them how to manage situations. So assertive skills and also communication, way to precise the role of listening and interpersonal relationship, and also sex, because sexual anxiety is one of the things which is an industry-induced neurosis. So that is at the base, as well as the cause-effect relationship with anxiety disorders and sexual dysfunctions is very common. So one particular session we devote to it, and some of the patients commented that we had excellent knowledge which is only available to the medical students. To that level it was in depth and it was life-changing. That was some of the feedbacks from people. Then goal setting, behavior change and commitment, these are all the things we work. So the results we get are phenomenal. That's what which made me think. We don't use the term disease. Most of the time we call them disorders. But I even go one step above. These are adjustment reactions with anxiety or depression because of lack of skills which they have not learned, or genetically they are predisposed this way. So once we teach them all these things, then they are able to manage when the next time some stressor comes in their way, or when they have a problem, they are able to manage on their own. So we are able to take the people off medication and also equip them for future disorders. So sustained change can be attained only when people are empowered and motivated to change the quality of their lives in general and the quality of their health in particular by changing their behavior on a permanent basis. This is achieved by changing their thoughts, feelings, actions, and habits and character over a period of time using the group process. So some of the things I talked might look like faith healing. I am not trying to become a new age guru, but some of the things may look like that. Thank you very much for the time and the opportunity. We'll go in for the questions.
Thank you. Thank you very much, sir.
Read through for want of time. Thank you.
Okay, no?
Yes, sir.
Thank you very much, sir. I think there is no question in the chat box. We request all the audience. I think 2098 people have attended this talk now. We would like you people to just send a questions there, or lift your hand. We will unmute you to ask direct question to Dr. Srinivasan. Meanwhile, anchor me and Nikita has one or two questions we would like to ask directly to Dr. Srinivasan. Sir, actually, we are a psychiatrist. We are a medical professional. We are bound to think like a illness, right? So we have ICD-10 and DSM-5, or now ICD-11. So what I understood from your presentation is that many of your group therapy participants may not have full-blown psychiatric disorder, like anxiety disorder, but they have anxiety as a core. So any people who have anxiety can attend your group therapy session. Am I right, sir?
Hey, anybody who comes to me as a patient.
Yeah, as a patient. But it means
they are treated in the initial stages. They have full-blown anxiety disorder, mild moderate depression, sort of somatization disorders. So they are treated with drugs initially, and once they are improved to an extent that it's not a disorder anymore, that is the stage at which they attend, because we are aiming at a permanent cure and taking them out of drugs.
And what I understood is that, sir.
I'll explain.
Yeah, yes, sir. Yes, sir. Please go ahead, sir.
If we leave them at the same stage where their core beliefs or other things are not changed, and once they are improved with the drugs and you reduce and stop, they are going to relapse immediately. So that's the reason why we have to change the pattern of thinking, everything, so that when they face with a problem next time, they don't relapse. So that's the aim of the therapy.
Yes. Sir, we are working with a new concept in mental health, especially to cover non-psychiatric mental health issues, like illness is one spectrum, wellness is another spectrum, and middle there is a called distress spectrum, where we are heavily working towards that in a telemanus program. So considering that thing, do you think the kind of group therapy which you are doing is only exclusively should be delivered only to anxiety disorder people, or it can be delivered to people who are having anxiety of any nature without even disorder?
We don't have to wait for a disorder. Why should we?
Yeah.
So anybody seeking help, or we should even promote people at the earlier stage. We are talking about treating schizophrenia at the prodromal stage.
Yes.
Right?
Yeah.
To prevent. So
Yes.
in other specialties, they are talking about primary prevention, secondary prevention, tertiary prevention.
Yes.
We are only doing tertiary prevention in schizophrenia,
Yes, sir.
probably secondary prevention in anxiety and depression. So we should
Yeah.
go to the primary prevention. So in
Correct.
fact, I and a friend of mine at Chennai have started a program at age 8 to 12. This is the vulnerable age where we are teaching optimism, hope, resilience, and faith. These are all the 4 core concepts with 8 sessions. We are trying to teach them because if we teach them, it can prevent future mental illness. That's the core concept. So we can encourage more people to come in and seek help so that 1, we can eliminate stigma. 2, we can prevent a lot of people going to the alternate therapies which have no
Correct.
scientific basis. And we will
Yes.
also prevent a lot of people going to the gurus and sannyasis seeking
Yes.
relief. So
Yes.
those are all the kinds of people who should be coming in here, where we
Yes.
can offer scientific relief.
Yes, sir. Thank you, sir. I'll ask my co-anchor, Dr. Nikita, to ask one questions. Then we'll wait for somebody. Gnanendra Kumar is lifted his hand. We will allow him to talk next. Okay. Thank you.
Thank you for that wonderful and comprehensive presentation, sir. So I just had a question about how does a typical session look like? 3 hours. I mean, do they come in and how do you start the session? How does the middle look? Can you just give us a few points about that?
Okay. See, the first session is no more a first session now because it's a continuous rolling session. Like each group is 12 sessions. So when I start May 3rd Saturday, I'm going to start a new group. Already the existing people who want to continue will be there. So they will be sharing their experience. That will be the first part. Then I introduce the core concepts of 6 or 7 exercises like the 1 hour, 1 minute, observing the breath, and planning and revision. These are all the kind of concepts. On day 1, I do it.
Yes.
Then day 2, like I have the syllabus training and things like that. So each session is structured like 1 hour to 1 hour 15 minutes of feedback from the participants who are willing. In fact, it's more like a class. I ask them to come with a written feedback. So people come and give it. Based on that, I select a few people.
Yes.
Somebody who says, I don't want to talk in the mic, they write in the feedback itself, please don't call me. So everything is optional here. First 1 to 1.5 hours, it will be a feedback of the previous session, what they learned and what changes it has made in them. The second 1.5 hour, we give a new input. So
Yes.
like that, then the next session when they come, they also combine the first session and the second session. Based on these 2, they give. What happens is, why I prefer a large group is, see, any group, there are only 10% to 15% people respond.
Yes.
Rest 85 to 90, they are silent observers.
Yes.
So if you are starting with 10 people, there are only 2 people giving a feedback.
Yes.
If you are going with 100, there are 10 people giving a feedback. That's why I find the larger group much more productive, right? So
Yes, sir.
at the end of this feedback, the next one is given. And see, every one of you might have heard during your school days, there are 3 types of students. One is like the camphor, immediately they catch fire. The next is like a charcoal. It takes time, but it stands up. Third is like the plantain peeling, right? It doesn't catch fire at all. So the people like camphor, they catch it immediately, they come and give the feedback. So that motivates the next layer of people. Then they come. Then that motivates the backbenchers. Like that, there are some people who get the impact only on the 7th or 8th session. Whereas some people get it in the first session itself.
Yes, sir. Thank you. I think that was a very interesting perspective. So we now have some questions from the audience.
Yeah. Now, can you just unmute Gnanendra
Dr.
Kumar?
Gyanendra Kumar, can you please unmute?
Yes, sir. Myself, Gyanan Kumar, based at Lucknow. Sir, it is very appreciable program conducted by the Telemanas. Every counselor of the Telemanas who is working Telemanas will be benefited. I am also thankful to Dr. Suresh. He has started this program in all over India. So Sir, I want to ask, these are the uh, counseling, and on in telemanasis there is no video setup. Only is the audio voice, on the voice, or there is no video chatting, only voice chatting is there. So how is possible we give the group counseling or a single counseling to our client at
Now,
is
I
it
don't
possible?
know. During COVID session, I conducted this group therapy over Zoom. So more than, I think I
Yeah,
got
sir, it is a Zoom, it is possible,
yes.
but the call come from away from the other district of the different telecenter of the UP, like Agra, Bareilly, Banaras, and Gorakhpur. So there is no video chatting, only the audio chatting is there. So
Okay,
how is
sir.
it not
This is
possible to the group
Srinivasan sir,
therapy or
the
counseling?
question you are asking is out of syllabus for me. Probably Suresh
Yeah,
is.
I asked Dr. Suresh.
और ज्ञानेंद्र जी पहला चीज ये है कि टेलीमानस में ऑडियो है तो रिसेंटली 1 week back we started the video, we have rolled out the video for Kashmir, Tamil Nadu and Karnataka. They were doing, now we are rolling out across the region wise. The video calls will be there, it is 1-to-1. The group therapy नहीं होगा अभी फिलहाल.
Yeah, yes.
It is only video consultation will be planned already. We have already completed 250 and odd video consultations based upon the various reasons. So वो टेलीमानस और डॉक्टर श्रीनिवासन का टॉक पे मिक्स नहीं करना है.
Yes, sir.
वो
So
mix
I
मत
want to
कीजिए.
ask some of the queries. This program is very much appreciable, sir. Started by you, sir.
Thank you very much, sir.
आपको
We'll
hands,
go for next question.
Thank you, sir. Jnanendra
no,
ji,
sir.
thank you.
I think
So thank you.
Sir, I think
there are a lot of questions in the chat regarding
yes.
the.
Sir, I have started
Yeah.
first Telemana Center UP. I have started in Agra, so that's why I'm asking.
No.
I always
Yeah, please
मतलब,
mute.
आपके जो session
Yeah. Can we, sir, Dr. Srinivasan,
Yes.
sir, would you like to take up question from the chat if you are reading there?
No,
It is
you
interesting
can
for-
read. It's difficult for me. You can ask the question and
Yeah.
answer.
Sir, Roshni is asking, sir, if someone has a panic attack during the session, how to manage it? What if other participants get anxious seeing this?
No, that's if somebody gets a panic attack, we teach them panic management skills, and that will help other people to learn from that. So we use it as a positive experience, but fortunately for me, it has not happened so far. Anybody has developed so far. Because as I said, like they are well prepared before allowing them into the group therapy. In the sense that their symptoms are under control, their panic is under control, that is the time they are entered into the group therapy. But even if it happens, I am comfortable that I can handle it, make them quiet, and also other people to learn from. Even if it happens to me, I can overcome that. That's the actually learning model that we use.
Thank you, sir. So there is another question from Rama S. If heightened anxiety is a trait of an individual rather than a state, whether therapies will help them?
Yes, even if it is a right, that's what we are focusing here. Like over a period of time, we are trying to reduce it and give almost all the possible techniques to reduce the arousal. And there are, as I said, different people take different time frames to overcome that, but ultimately they overcome it.
Sir, another question from Archana Gatkaini.
Yeah.
Say, what qualities make someone a good candidate for group therapy?
I mean, one, willingness to participate, number one. Number two, like willing to come on a regular basis, the discipline. If these two are there, then everything is taken care of.
Okay, sir. Thank you. Next.
They don't have active symptoms at that point of time. Almost like 80 to 85% symptom reduction is done. Only after that, they are put into the group. And somebody has even asked, how do you pay individual attention? In fact, among the large group, we also encourage people to make small groups, like 5 people groups. They talk among themselves and they interact among themselves. In fact, I tell them, you keep interacting among yourself even in between the group therapy. Otherwise, it's not like once a month. There is some reminder that's going on to the individuals every day by the group. And we also have a WhatsApp group for the entire members that was started post-COVID, and that has helped people.
Thank you, sir. Sir, I have a questions. You said that you treat patients with medication, then once the symptom control is occurred, then only you will select for the group therapy.
Yes.
Considering that thing, what do you think the role of pharmacotherapy in management of anxiety disorder in your practice?
Even today we were discussing, there was one patient on antidepressant relapsed. So I was discussing with my assistant who has joined me newly. See, whenever you think of increasing the antidepressant dose, which is not going to be effective, unless there is what precipitated here and how to address that. So it's more of therapy, individualized, identifying the triggers, coping appropriately is going to be more effective than drugs as far as anxiety disorders are concerned. The role of antidepressants is, I use only the lowest possible dose. 5 milligram escitalopram at the max. If it doesn't work, increasing the dose is not going to work as far as anxiety disorders are concerned. In the initial stages, I use benzodiazepines for the first or second visit, because you have to give them symptom reduction. Day one, you are going to use an antidepressant, they are going to run away from you. So unless otherwise they feel the relief, so make them come again, then only you can probably treat them in a proper way.
Yeah, thank you, sir.
Thank you, sir.
One
So
more.
there is another question. Although Ritik Chaurasi is asking, although they joined the group therapy, but their surroundings, which could be a possible maintaining factor, remain unchanged. How do you deal with such individuals having this issue?
That is, their family surroundings are contributing.
All any kind
Any
of surrounding,
environmental factors which
Yeah, their environmental factors are the same. In fact, that is the focus of my therapy. Right?
Okay. Yeah.
In fact, my golden statement is the only person you can change in this entire world is yourself. But if you change things around you, change.
Yes.
But as long as you are trying to change the other person is trying to change you, and finally both are defeated. So accept that others cannot be changed, environment cannot be changed, they are going to remain constant, and how you can equip yourself to manage that. That is the focus on the therapy.
Okay. Sir, another thing, negative outcome of daily aspect, how group therapy helps. I think you already answered the questions, right, sir?
Yes.
Some kind of. See, another thing, before we get another questions, I want to ask. We actually, we understood that you are a founding father of positive psychotherapy in India, and you are using.
So that was one of the titles given by a group of psychologists.
Yeah.
But I've been doing it.
Yeah. I think Nikita will be more happy to listen that.
Okay.
Considering that, sir, are you using only this psychotherapy only for anxiety disorder, or anything else also?
No. This is, see, I play two roles. One, psychiatrist. Another one, I conduct personality development program. That's the name of GATE, Global Academy for Total Empowerment. So I learn a lot of things and I keep interchanging. So growth is my primary focus. So a person who is already functioning well, I take them to the next level. So a person who is performing at a level lower than his potential because of illness, I make them come out of it and make them the growth model. Right,
Yeah.
that's what goal setting is included.
Yes.
And a lot of things about how to realize their potential while increasing the self-awareness. All these things are taken into account.
Yes, sir. Sir, another way, somebody, Ram Malkani, she or she, right? He. I want to share my anxiety. He has just written. Can we allow him to talk, sir?
Sure. If it's
Yeah, it is
okay
a group therapy. Let's see how it works out. Group therapy.
Right.
Yeah. Please, can you allow him? Ram Malkani
is there.
Yeah. Can you allow me? Please, he is there. Right,
Oh,
sir. Last. Yes, sir. Sir, please talk, sir.
Sir, I'm a bit sorry. You
Please
can hear
introduce
me?
yourself and
You can hear
ask
me, no, sir?
questions. Yes, sir.
Yes, we
Hello?
can hear you, sir.
Okay, so I was about
So your audio is not clear. If you could switch the video.
Yeah.
So you can switch off the video and ask the question. I think there's a bandwidth problem.
I missed the last. You can hear me, no, sir? So,
Sir, please switch off your video and ask questions, sir. We saw
what
your
should I
face.
switch off?
Yes.
Yes,
Yeah.
sir.
That gives better clarity.
Is that okay?
Yeah.
Now you can hear me? Is that
Yes,
Yeah,
sir.
that's right.
Yeah.
okay? So, sir, I have undergone psychoanalysis for say 10 years, 5 days a week, 45 minutes each, and for 10 years once a week, and now last
It's already
6-8 months twice a week. But sir, I seem to have anxiety all the time, and I have some kind of a social phobia also, and I seem to be self-occupied with my own performance, myself, my anxieties, my health, and so on. And I am, of course, functional and I'm practicing. But what I thought was I'll use this opportunity because I first do, sir. And then let us see by talking to a group, Of course, I don't see the group, but talking to a group and you talking to me, whether it makes some difference.
Yes, now you have overcome your barrier of fear, social anxiety. You wanted to be asked, right? You wanted to talk in front of a group, all that. So take it as a positive feedback into the loop. You have to feed yourself into the feedback loop that, yes, I was afraid, but I could do that. And constantly, when you keep doing it and you keep working on your self-esteem as a core, then definitely you should be able to overcome your anxiety.
So how does one work on one's self-esteem? Is there some way or just by talking about it?
No, there is a method detail. I mean, it's a 3-hour session by itself, self-esteem. Like, identify what are all the things you are good at it, what are all the things which are pulling your self-esteem down, and is it real or imagined? And then, like the 3 things I am grateful for, the more things you are starting to appreciate what's happening, what you are doing, all these things improve your self-esteem.
Sir, psychoanalysis is one process where you're talking about or yourself, your own anxieties or whatever comes in the mind, what is called free association. And I've done it for so long, sir. It must be a record in the countries.
But it has not worked. Let us try something. That's what they say in NLP.
No, sir, I'm better, sir. It's not that it has not
Okay,
helped.
it will probably take more time to go into the
if I could
details.
make use of this opportunity.
So,
Yeah, thank you very much, sir.
Yeah.
We'll go for next question. Yeah.
Yes, sir. Sir, I wanted to know what do you think are some of the points that the listeners can incorporate to introduce group therapy in their practice, be it in a private practice setting or an institute level? And what do you see are the future directions of this?
no, in fact, 2009, I took over as a president of IPS Tamil Nadu. My talk was on this. 2019, Vengovara Varation, my talk was on this. And 2025, probably the Vishaga Varation, and that resulted in starting anxiety disorder clinic at Nimmans. That's what Dr. Manjunath told, right? Which was long pending. So I want more people to start group therapy, even at a smaller level. Engage them. Once you get a hang of it, then start increasing the numbers when you have
Yes,
more
sir.
people. Because like whatever model, there is nothing like a structure. I develop my own model, whatever model suits them, let them start doing it. And I want more people doing it because only then you can engage more people. The patient engagement will be there and the satisfaction will be better than one-to-one therapy when you give it in a group therapy. So I want more people to take it up. That's my aim. In fact, one of my friends, when I sent this this thing, he told me like, you have been thinking originally, doing it consistently, you had your validation for your patients first, and now you are getting your validation from academic institutions, right? So that's the path of growth. I want more people to take it up. To the
Thank you,
best
sir.
of my knowledge, nobody is doing at such a large level, not necessarily, but even at a smaller level.
Yes,
Even
sir.
if you want to do it with homogeneous groups, you can do it. Except for Alcoholic Anonymous, that's a self-help group. That's not in a very structured group therapy, you can call it. But
Yes.
more psychiatrists should be taking it up. That's my, if more people are taking it up, then that has served the purpose of this talk.
Yes, sir. Thank you. So we have one last question. Abhishek Gupta has a question. Mainly in relationship issues, anxiety is common symptoms. They neglect self-care, unable to share their emotions, lack of social support, unable to manage their emotions, and they feel panic. How do you proceed in such a situation in group therapy?
So here there are multiple layers. Anxiety is a symptom of marital relationship. So unless otherwise you do the marital therapy, counseling to manage the relationship, teach them the skills to manage the relationship first and manage anxiety in a symptomatic way with the drugs. And once the marital issue, relationship issues are solved, then we can put them into the group, not earlier than that.
Yeah, now question, we will end the question answer session, sir. I'll just try to summarize what we learned today. Yes, what you said is true, sir. It is anxiety disorder clinic at Nimmans was long pending dream. And after meeting you in Ipsocon, I think it has triggered again the thought of reviving the idea to start anxiety disorder clinic. Yeah, now see that anxiety is a ubiquitous, every human being having anxiety. But when it comes to anxiety, not always all anxieties are negative. There are some positive anxiety, many of the things are negative anxiety, especially medical doctors be bothered about illness, so which is anxiety disorder. Coming to number one, psychiatric disorder in the community, which is anxiety disorder. Unfortunately, the majority of psychiatrists focus in practice is not the anxiety disorder per se. No, now I think time has come, especially after COVID-19, I think focus of psychiatry should turn towards anxiety disorder, or probably anxiety is the one symptoms every human being on earth understand quickly. Where I think psychiatry can give a best answer for the anxiety which people are suffering across the world. And that, sir, we are happy to note that you started in 1995, your work in group therapy. Almost you have finished 30 years. And that too in a private practice settings. And another very interesting things which I have found in group therapy is that the caregiver of this anxiety disorder also allowed in the group therapy and talk about it. That is very interesting. And another thing is that, sir, this is a original, innovative idea, even though some of the things are been told in many people, but mixing that thing in a group therapy, in working in a bigger framework in a group, I think it is a original work in India, which you already began. Now, I think it looks like that you are highly motivated person. You are able to conduct the group therapy for about 30 years. Considering the people, majority of the people are not highly motivated. Now, next question comes that how this can be integrated in our private practice of the psychiatry. Yes, in academic setting like us, yes, we can do some kind of group therapy, we can start. But in private practice, I think we need motivated people to begin and start working. Maybe it is not a highly rewarding, yes, coming to the commercial aspect of the group therapy, but it definitely gives a edge for keeping the patient intact with you for a long time. That gives a will. Considering the another thing which I learned is that even though it has been called as anxiety disorder, I think many of the people who doesn't have anxiety disorder, just anxiety for various reasons, which we call as a mental distress, will also get benefited. More than that, what I felt, even though people doesn't have illness, even though people doesn't have distress, but those kind of people will also get beneficial, especially what the phenomena process which you said is a positive psychotherapy, where self-esteem is being targeted, emotions are being targeted, where they as you said, it is you are gone beyond pre-morbid functioning. So where more than that pre-morbid functioning, it is the maximum, optimum, achievable things one person can achieve. So you are targeting that, and it is excellent to learn, because we are heavily focused on illness. So this is another eye-opening for us to learn. And now at the end, I would like to convey my thanks to Niman's administration, which allowed this webinar kind of things to happen in Anxiety Disorder Clinic webinar. And in our team, with Nikita, Praveen, and Saranda, who has helped us to give a back-end support and front-end support, and our NDA technical team. And topmost, and another thing, one important person who has motivated for us this thing, person who is sitting left to me. Maybe he's not in the, I think he's in the frame now, Dr. Suresh Badamat. And one of his dream was to work in anxiety disorder for long. And somehow he OCD has worked, and now his prime work is for forensic psychiatry. And one of my dream was to working in anxiety disorder for quite a long time. I think I will start working, and I hope to see many of your principal maybe worked in anxiety disorder, at least not even anxiety disorder. We are thinking of starting mental distress clinic in Nimans, which is not a psychiatric disorder, where I think many of your process and your principal will definitely helpful. And we will keep in touch with you, sir, and maybe we'll learn from more from you. And if possible, I would like to visit your Coimbatore and see what exactly is happening. Even though I am not accustomed to Tamil language, but I'm sure I can learn from you and with your people who are participating. Thank you very much, sir.
Sure, sure.
I think we are winding up the session right now. Anything, sir? Final session talk from
Okay,
you.
thank you very much for.
Anything you want to talk, sir?
Sir,
I'm honored and humbled that my talk was also the stimulating factor for starting anxiety disorder clinic at Nimans. Thank you very much for that.
Yes.
definitely, sir. We need to learn from a lot of things.
I'm willing
because-
to come anytime to Nimans when you start a group therapy. I'll inaugurate that and give you the initial tips.
Okay, sir.
You can
Definitely,
count
sir.
on me.
Definitely, sir. Actually, we take borrow easily things from West. Group therapy 8 to 12. But we forget that what cultural adaptation, local adaptation is required. We forget that. If somebody else had told from West instead of our Dr. Srinivasan, it would have been considered as one of the greatest speech in the world. But I believe having a cultural adaptation, having our local therapy, what you are doing an amazing job, sir. We would like to adopt a lot of things from you. And we would like to start even the group therapy because the numbers are huge. Common mental disorders are simply mind-boggling, 15 to 20%. And this is about anxiety disorder per se. Distress, what Dr. Manjunath is saying, the number is around 30 to 40% of our population. Simple, yesterday's terrorist attack, the
Yes.
number of people who are distressed looking at the way it is happening, the